And we've been hearing that from today, anyone in England who has been in close contact with someone who tests positive for coronavirus will be told to self-isolate under the government's Test and Trace system.
Let's have a look now at how that might work in practice. So, if you show coronavirus symptoms, you should self-isolate straight away and book yourself a test, either online or on the phone. If you test positive, an NHS Test and Trace official will call, text or email you to discuss who you may recently have been in contact with.
Now, this will include anyone you've been within 2 metres of for more than 15 minutes, or anyone you've been closer than 1 metre to, face to face. So, this could be people you live with, colleagues in the office, or friends you may have seen.
What happens next is the tracers will then call these people and ask them to self-isolate for 14 days, even if they don't have symptoms. Members of their own household do not have to quarantine unless they also develop symptoms.
OK, so that's how it works. We can talk to the Health Secretary Matt Hancock to see how it's going to be put into practice. He joins us now from central London. Thank you very much for your time, Matt Hancock, this morning.
Pleasure. Thank you for having me on, and thank you for such a clear explanation of the new policy.
Excellent. I'm glad you approved, because I thought then if we did that, then we can get into the nitty-gritty and any kind of holes there maybe that you can perhaps fill in. Let's start with 9 o'clock this morning, shall we? In an hour and a half's time, what happens? How many people are going to get on the phone? How many people are they going to be contacting?
Yes, so we have 25,000 contact tracers in the system who are raring to go. They've been trained over the last few weeks. 7,500 of them are qualified clinicians, and they're ready to go. The first thing that will happen this morning is that the 2,000 or so people who tested positive yesterday will receive contact. They're the ones who we know have got the disease, so they are self-isolating at home. And they will then have that discussion with an NHS clinician about who they might have been in close contact with, so as you described.
Let's pick up there then. How does that conversation go? I'm calling you, for example. You tested positive yesterday. Yeah. Hello, Mr. Hancock. Understand you've tested positive. We now believe that anyone you've been in association with, as we described earlier, within 2 metres for 15 minutes or more, within 1 metre face-to-face, we would like you to tell us who you've been in contact with. Will you tell us? And what if you say no?
Well, I think the vast majority of people will say yes, because it's so important for all of us, because if we all participate in this system when asked, then we'll be able to more safely lift the lockdown measures and lift the aggregate national lockdown by having this more targeted approach.
There's going to be an element of trust, isn't there, in terms of, and if we're honest, Mr. Hancock, we've seen it over the last few weeks with the good weather, and we've seen as measures have eased, some measures may have been bent, shall we say. You're asking people to admit, perhaps, that they've bent some of these rules, that they haven't abided by this, and you're saying that you think everyone will do that?
Yes, and of course that conversation, as with other conversations with NHS clinicians, you should be absolutely upfront. And in fact, where this works best is where the clinician and the person who's tested positive essentially work together to work out, who you might have been in contact with. And of course, because one of the very nasty features of this disease is that it transmits before you have symptoms, that conversation will be about what's happened over the past few days, including before you became symptomatic. And the evidence from where we've trialled this, both Public Health England, who do this as a matter of course for infectious disease outbreaks, and did this at the start of this crisis, and then also on the Isle of Wight, where we've been trialling this process over the last month or so, the overwhelming majority of people get stuck into that and realise that, if you've tested positive, it's so important to let other people know who might have caught it, for their sakes, as well as for the sake of trying to break the transmission of the virus. So we're confident that the vast majority of people will participate.
Some scientists have said that this is going to prevent or reduce 5 to 15% worth of infections. Is that enough?
Well, I saw that paper, and that paper's predicated on relatively slow turnaround times of tests. And this is an important other part of the system, is that, of course, we need to get that test result back as fast as possible.
That was dependent, I just want to clear something up, sorry, that was dependent on finding contacts within 3 days.
That's right. And our goal is that we have the turnaround of the test within 24 hours. We've now managed to get the system so that 84% of the tests that you take at a drive-through centre are turned around within 24 hours. And the Prime Minister yesterday set us the goal of having every test turned around within 24 hours.
When you say turn around a test, I will be picky because I think we want to be absolutely clear, don't we, this morning as this is launched. When you say turn around a test, does that mean from the moment, say, if I think I have symptoms, I call up 119 and then in 24 hours I'll have the test result? Or when the test is sent, when the test arrives on my doorstep, or I go to a GP to have the test and it's taken, what's that 24 hours?
Well, of course, the time that really matters is the time from the moment you have symptoms and call up. And this is another important part of it. It's really important that everybody who has symptoms applies for a test straight away. And so from that moment until the moment that we can get the positive result back, if that's what it is, if it is positive, and get going on the contact tracing. It's that end-to-end time that matters. Now, at the moment, because we haven't started this system yet, the time is measured from the swab until the test result. But of course, we need to measure that end-to-end process. So I'm confident that we can get that turnaround in most cases faster than the academic study that you were citing about the impact of this on the disease. But of course, all of this is about doing the very best that we can. Not only my team, the people who are working in NHS Test and Trace, but also all of us who are participating, those who test positive and those who are contacts and so get the communication from NHS Test and Trace that they need to self-isolate. If everybody does our best, then we will get that rate of transmission down, and we'll break the chain of transmission from the virus more often. So it's shortening the test time is an important part of it. So too is participating in the conversation that we started off talking about, and so too is the isolation of people who are contacts.
With that conversation that's had, how clear? Some people just may not remember who they've been in contact with for a certain amount of time. What if I think I've been in contact with someone, I don't know, for 12 minutes, or I haven't timed it, I don't know if it's 15 minutes. Where's the balance lie with the people who are calling us? Where does the balance lie? Is it caution? Is it always be overcautious or be a bit more relaxed? What's the tone of this?
The tone will be very much like a conversation with your doctor. So the people who will do that interview to find the contacts are clinicians, and doctors are absolutely trained in trying to understand the most likely thing that happened in a world of uncertainty. I mean, that is what doctors deal with all of the time. Uncertain symptoms, people not knowing quite when the symptoms first came on, and things like, well, I'm not sure whether I was in contact for 10 minutes or 15 minutes. That is the world in which doctors operate all of the time. So essentially, that will be a clinical judgment with the best aim to be to find the people who you've been in contact with under 2 meters for 15 minutes. And as you say, face-to-face, closer than that. What
would happen if I was called up because someone had said I'd been in contact with them, they tested positive, and I said, no, I haven't? What happens then?
Well, at the moment, we're doing this on a voluntary basis because we think the overwhelming majority of people, when instructed to self-isolate by the NHS, will do so. But of course, we have the legal powers to make this mandatory if we need to. I'd just rather not do that.
What would make you need to do it? What evidence would you need to see?
Well, obviously, we're going to track very carefully the proportion of people who do what they're instructed to by the NHS. But we're pretty clear from the research that we've done and from the tests that we've done that the vast majority of people will.
Angela has been in touch, and she's talking about test and trace. She says, I'm not comfortable passing on my contacts' contact details, if I have them, or anyone passing on mine. GDPR nightmare. So what would you respond to that? I've got a couple more as well.
Well, I think, firstly, it's in the same way that if you are contacted by the NHS now and you're asked about another symptom or disease, you would talk to them about it. There are very strict confidentiality rules that are in place, exactly, both under GDPR, and then the medical system has its own system of confidentiality as well. And actually, in practice, we've found that only a tiny proportion of people have that sort of reaction.
I don't think many people really want their phone numbers handed out.
Well, all I can tell you is the lived experience in the pilots and in the past when this has been done by Public Health England, that is a very, very small proportion of people who react in that way.
If someone's already had it, has tested positive for it already, and is named as a contact, do they still have to isolate for 14 days?
Yes, unfortunately they do. This one's quite close to my heart because I've had it and I've tested positive for the antibodies since, and I would still have to self-isolate, yes. And the reason is we don't yet know if people who've had it still transmit it to others. Claire
asks, regarding Track and Trace, how do we know who's going to pay our wages if we have to isolate every time we get a notification of being near an infected person? Because effectively, you could be told 1 week, take 2 weeks off of isolation from work, lose money if you're put on statutory sick pay, which is, what, £95.85 pence a week. 2 days later, you could be told it again.
Yes, the onus is on employers, and in the same way, when you're instructed to go home by the NHS, that is equivalent to being off ill. And we did put in place support much earlier in the crisis to deal with this challenge. It is a very significant problem. And the problem of people getting called repeatedly, one of the things that will come through with this new NHS test and trace system is a strong incentive on employers to ensure that there's social distancing in the workplace, because that will reduce the number of contacts that people have at work. Because there's also the challenge for an employer. Take a small employer, if one of their employees tests positive and they haven't been doing social distancing in the workplace, then suddenly a large proportion of their workforce might have to go home and self-isolate. And the solution to that is to follow the social distancing in the workplace guidelines that have been set out.
This could happen to a worker who's just travelling on the tube. It's not the employer's fault, it's not the employee's fault, and yet you're saying the employers have to pay, and you've no guarantee that they are going to pay and support people who are then facing the prospect of living on £95 a week.
Well, we do have the guarantee of the recourse that's there in law, in employment law, and we extended that, as I said, earlier in the crisis.
Let me ask
and so that is in place. But yes, I'm afraid that people may, if they repeatedly are in close contact with positive cases, then they may repeatedly have to self-isolate. And there's a reason for that, because this whole thing is all about trying to break the chain of transmission in a way that is much, much more targeted at where the positive cases are. And at the moment, we estimate there's around 7,000 to 9,000 positive cases in the country. We know who 2,000 of those are. We've got to hunt them down, because that's how we get on top of the virus and lift the wider lockdown measures.
You say hunt them down. You say this is urgent. You say, and you have used the phrase civic duty. You're asking the British public to follow these measures to the letter. That's been very clear throughout this interview. Do you understand how this sticks in the throat for so many who have seen a member of your team, a close member of your team, choose to interpret the measures to his personal advantage? I am talking about Dominic Cummings, and I am talking about the government's insistence to stand by him, yet you're asking all of us to stick to the rules by the letter.
I am, and I think the vast majority of people will. And the reason is because it's so obvious, Naga, how important this is for getting through this virus. You know, it's not doing this for people aren't doing this for the government or for me or anybody else. They're doing it for their loved ones, for their community, for the people they themselves are close to, because, of course, passing on this illness is not just about transmitting the virus. People, it's a very serious disease, as we've seen, and the more that people abide by these rules, the more they follow the instructions from the NHS, the safer we'll all be, and the easier we'll be able to lift the broader lockdown measures. And I think that is a huge motivation for people to do the right thing, and I think the vast majority of people will.
Matt Hancock, I've gone over time, but thank you very much for taking a lot of your time, but thank you for going through that with us.
Very good to be with you.
Health Secretary, thank you.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.